Even its most ardent supporters would argue that limb lengthening is any day at the beach. It can be painful, it involves multiple surgeries, and it always requires months of strenuous physical therapy.
It's a 3-year chunk out of this kid's life. It's typically during their most formidable years.
Dr. Michael Ain
I'm 4'3".
is in a good position to know what being a little person can mean.
What kind of dog do you have again?
Original outcome.
An original outcome. They told me, they said, you can't be a doctor because of your size. You wouldn't hold the respect to your patients because of your stature. And I looked at him, I go, what do you mean? He goes, well, your patients don't respect people. They want a nice tall guy with a white coat come in. Okay, take a look at your thumb again, one more time. You are the man.
Tall is out of the question. He won't wear a white coat, but Ain today is a pediatric orthopedic surgeon at Johns Hopkins.
Patients measure me, no pun intended, for what I can offer them and what I can offer their child, not by if I can dunk a basketball.
And he has very mixed feelings about operations just to make kids taller.
There's risk of paralysis, risk of loss of limb, death, nerve problems, skin problems, that you don't get 11 or 12 inches. Maybe you only get 2, 3, or 4 inches. And you put this poor child through all that.
As an active 12-year-old, he says, he actually turned down similar surgery.
My life would have been easier, possibly, yes, without a doubt. I would have not had people stereotype, people make fun of me, people poke at me and look at me differently, 110%. But on the other hand I don't know if I would have been a physician.
But he made the decision, he says, not his parents, which is what worries him most about lengthening when kids are so young.
I only know one family who's having their child lengthened, whose parents, one of them is of little stature, short stature. All the other families are both average height parents.
Who cannot imagine their child going through life like this.
Bingo. And so there's guilt. So here they are, mom and dad, they have a kid, and the kid's little.
And they say that we're going to do this for
my child. Or maybe are they really doing it for themselves?
Opponents of this surgery also argue that using such drastic measures just to make little people taller implies that there is something fundamentally wrong with the way they are. What we should be doing, they say, is not adding inches, but changing attitudes.
I think it's more important to point these things out to society and say, look, why do the buttons always have to be high?
Actor Danny Woodburn.
Why do the men's room mirrors have to be out of reach? You know, why does it have to be that way? Because it looks good?
But if it is that way, and
change it.
Until it's changed.
Until it's changed, fight to change it.
I mean, just because certain aspects of society have a misperception, so do we change that by changing our appearance, or do we change that by saying, look at me, I can do anything, and I'm little, so back off.
That's the kind of confidence Major League pitcher Steve Reed and his wife Terry are working hard to instill in 6-year-old Logan.
What are you doing? Huh? You tired?
It seems to be working.
How you doing, bud?
Even though Steve Reed makes his living as an athlete, he is not keen on surgery for his son, at least not yet.
If he got to the point where he wanted to make that decision at 13 or 14 and we would discuss it, I would, you know, it would be something I would be open to listen to. That's 10 years down the road. But again, I dig him just the way he is. I love him to death. And to me, if he's 4'6" or he's 5'2", big deal. He's to me, at least, he's still Logan. You know?
And I wouldn't do it for any other reason other than for him to be happy, if that's what he wants, to be happy. I don't care what people think either.
Hot potato, hot potato. Hot potato, hot potato.
Do you think that this will define who he is, though?
I don't want it to. I want him to be a person who happens to have dwarfism, not a dwarf. And I think that's who Logan is.
Us little people, we're used to getting the short end of the stick. You don't get to laugh at that.
a sentiment Danny Woodburn well understands.
I don't want to be seen as a little person actor, a dwarf actor. I'm Danny Woodburn, I'm character actor. That's what I studied to do. There were no little people acting classes.
Back at the Sinai Clinic in Baltimore, it's not yet 7 a.m., but things are bustling. Nick is about to go in for his first operation, hoping to add at least 4 inches.
To be taller, to reach high things. And maybe, like, to reach the freezer. And I hate being small.
He's excited, but also nervous.
I cried last night because I was wondering if this was the right choice or not.
Morning. How you doing?
His surgeon has few doubts.
Everybody gets cold feet. It's stressful to have surgery and to go through this. And today, I can honestly say that not one family has ever told me that they regret doing this. I think that pretty much every patient who's gone through this in our hands, while it was hard, they all kind of say it was worth it.
5 months after his surgery, doctors took the metal frames off of Nick's legs. Today, he is walking again, and he's walking 5 inches taller.
Come in.